Hello everyone, welcome to the basic training for Aoralscan Elite. I'm Marcus, I'm the application engineer in Shining3D. Today's basic training will be divided into 4 different parts. The first part is the introduction part. I'm assuming that some of you may already familiar with this new device, but in this introduction part, we will use an actual all-on-6 case to give you more information about this new device. The second part is the Elite workflow part. In this part, we will do a comparison between the Elite intraoral photogrammetry solution or workflow with the conventional impression workflow, the digital impression workflow, which refers using the normal regular intraoral scanners to do the full arch fixed implantation cases, and the third one is the photogrammetry, or you can say extraoral photogrammetry solution workflow. The third part of today's basic training is the preparation part. We will give you a detailed information about implant system, the software and the PC, the scanner testing and the practice, the scan body sterilization, so on and so forth. The final part of today's training is the clinical case and workflows share. You will see 3 different parts in this final part of the basic training. The first one is the immediate loading for fixed full arch restoration. The second one is final restoration cases for fixed full arch restoration. And the third one is the implant restoration with multi-unit abutments. So as we just mentioned, we will use an actual clinical case to give you more information about this new scanner, Aoralscan Elite. Without further ado, let's just dive right in. Aoralscan Elite uses intraoral photogrammetry technology to quickly and accurately capture implant positions for full arch implant restoration cases. With 5 micrometer precision, it can capture accurate implant position data for both immediate loading cases and final restoration cases. As you can see from the recording on this slide, that this is a real case scanning for coded scan body position. We can use this accurate position data for not only final restoration production, but also provisionals for immediate loading cases. Especially with the help of the cell printer, you can deliver a fast provisional restoration on chairside. Okay, now let's give a look at this real all-on-6 immediate loading clinical case using Aoralscan Elite for a better demonstration of the new scanner. A 70-year-old patient came to Dr. Sun's clinic to replace missing teeth in his mandible. Dr. Sun and his team proposed an implant prosthetic treatment in the mandible with an all-on-6 procedure involving immediate implantation and immediate loading. The patient had 3 remaining teeth in his mandible and uses a removable denture. 1 week ago, the patient underwent immediate loading in the maxilla with a 3D printed provisional. First, we performed a pre-operative scan using Elite to capture the patient's pre-operative occlusal data, which was later transferred to the provisional tooth design. Aoralscan Elite is not only suitable for full arch fixed implantation restoration cases, but also highly accurate and efficient for common regular cases, including restorations, implants, orthodontics, and edentulous cases. Next, Dr. Sun performed the implant surgery, placing 6 implants in the mandible, and 3 remaining teeth were extracted, and 6 implants were placed freehand, with 6 multi-unit abutments attached to the implants. Note that the Elite high-precision scan bodies need to be mounted on the multi-unit abutment for use. And before scanning, healing caps were installed to prevent gingival collapse. The wound were well sutured within minimal bleeding. Blood can make the soft tissue scanning very difficult for Aoralscan Elite and increase the challenging for aligning soft tissues with the implant positions as well. So that's why we always recommend a well-sutured case for this kind of all-on-6 or all-on-X cases if you're doing the immediate loading. Aoralscan Elite is a 2-in-1 system combining intraoral photogrammetry system and intraoral scanning system that allows for soft tissue scanning using the intraoral scanning and capturing implant positions utilizing the intraoral photogrammetry technology. Then, the soft tissue data and implant positions are aligned within a single scanning workflow, collecting all the necessary data for full arch fixed restoration designs using one single device. If blood control is good post-surgery, Aoralscan Elite can complete the soft tissue scan within 1 minute. Next, the coded scan bodies are mounted on the multi-unit abutments, and scan bodies of appropriate length are selected for different positions, just ensuring their ends come together in the center. The scan body scanning process is highly efficient, and once enough markers on the surface of the scan bodies are recognized, the virtual high-accuracy coded scan body data will appear in the interface, indicating that the implant position have been captured. Then, both the soft tissue and scan body are scanned simultaneously for data alignment, with one scan on each side of the arch. Then you can align these two sets of data together. The same thing happens for the bite scan as well. Once the data come to the center area of the interface, then it means the scan is done. And after the scan is complete, the corresponding scan body library can be selected and the coded scan body can be switched to the implant scan body library. In this case, the preoperative occlusal relationship aligned with the soft tissue will be transferred to the provisional restoration design in exocad software. In some cases, especially for final restorations, Aoralscan Elite can complete the entire data acquisition and alignment, then directly import the data into exocad for design. After capturing all necessary data for this kind of case and get the design data back from the lab that you have collaboration with, then we can design the design file can be sliced and printed using the Shining3D AccuFab cell printer, and you can finish the whole printing within 20 minutes. After that, a curing process of 10 minutes is required to achieve optimal material performance. After post-polishing and sterilization, the patient can proceed with the trial fitting. For this specific case, the entire procedure took 4 hours from the very beginning to finish. The precise data captured by the Aoralscan Elite system ensured a passive fit of the provisional teeth. The efficient Elite immediate loading process reduced the restoration placement time and enhanced the patient experience. As you can tell from the summary part, it shows the time we spend on different steps. Soft tissue scanning, implant position capturing, data alignment altogether cost 10 minutes, including the scan body installation. And the designing of provisionals on the lab side costs 30 minutes. The printing costs 20 minutes using the cell printer, and the post-processing part costs 20 minutes. And the picture on this slide shows the status of 1 week after the surgery. That's what we can do using the Aoralscan Elite for immediate loading cases. Then we move to the Elite workflow part. In this part, we will introduce the Elite workflow and compare this workflow with the conventional impression workflow, the normal intraoral scanners workflow, and the extraoral photogrammetry system workflow. The first workflow that we'll introduce in this part is the traditional or conventional impression workflow. For the conventional impression workflow, first, a preliminary impression must be taken and a stone model will be casted to create a verification jig and a custom tray. Then the final impression is taken and the final model is scanned using a desktop scanner for fabrication. If the final impression is not precise enough, it may result in failure during the final restoration fitting, requiring all steps to be repeated for a remake. Traditional impressions are complex to perform, impression materials will deform, and it will cause uncomfortable experience for the patient as well, especially due to the high reliance of the traditional workflow on operator skills and experience. The second workflow we introduce in this part is the digital impression workflow, which means we're using a common or regular intraoral scanner for full arch fixed restoration. Using an intraoral scanner for full arch fixed restoration data acquisition simplifies the conventional impression taking process and improves patient comfort. However, the downside is that the accuracy of implant positioning in digital impressions is not sufficiently accurate. The main reasons are that edentulous mucosa lacks sufficient features for scan stitching, has high reflectivity, and the scan bodies have similar shapes, making it more difficult for the scanner to recognize images, leading to lower scanning accuracy. Additionally, the mobility of the soft tissue further decreases the intraoral scanning precision for full arch implants. The third workflow we introduce in this part is the photogrammetry scanner workflow. By photogrammetry scanner workflow, we mean workflows using extraoral photogrammetry system. An extraoral photogrammetry system was used to capture the positions of the implants. It is a fast and precise tool for measuring implant positions using photogrammetry technology. The extraoral photogrammetry system quickly records implant positions, achieving precise measurements even with uncontrollable factors such as patient head movements, but it also poses challenges for the user. The one thing is, it is a large equipment with the need of multiple operators. It's bulky and difficult to maneuver. The second one is multiple devices and softwares is needed in this whole process. Not only the extraoral photogrammetry device, but also you need a intraoral scanner to capture the soft tissue data, and then it causes the third challenge, which is complex workflow, because you have to use a third-party software to combine the data from these two different devices and align them in the third-party software. As we just mentioned in the previous slide, the extraoral photogrammetry device is relatively bulky and large, and the data captured using the extraoral photogrammetry system needs to be combined with an intraoral scanner or traditional impressions. The implant position data serves as a reference for matching soft tissue data obtained from the intraoral scans or from the extraoral scans of stone models. Using the Aoralscan Elite for full arch implant restoration data acquisition is highly efficient. You can complete bite scanning, soft tissue scanning, implant position capturing, and data alignment all within the same software and within a single order. The entire process takes approximately 10 minutes. This solves the problem of needing to purchase two sets of equipment for extraoral photogrammetry and importing data into third-party software for alignment, which is a complex and time-consuming process, greatly improving the efficiency of full arch implant restoration data acquisition. Aoralscan Elite also including other data acquisition functions, making it suitable for a variety of restorative, implant, and orthodontic cases, with fast scanning speed even in edentulous cases. This slide shows the different ways to capture the markers on the high-accuracy coded scan bodies between the Aoralscan Elite workflow and the extraoral photogrammetry system workflow. If you're using the extraoral photogrammetry scanner, the scan bodies are positioned to allow the visualization of a maximum number of markers extraorally. Then the extraoral scanning of the photogrammetry scan bodies is performed to capture the implant positions. However, the process is often limited by the patient mouth opening and the width of the lips, making it difficult to capture the positions of the implant in the posterior. While if you're using the Aoralscan Elite, the intraoral photogrammetry scanner, combined with the IPG tip, specially designed for Aoralscan Elite, the Aoralscan Elite is able to easily intraorally scan all the necessary markers on the scan bodies, as you can see from the recording on this slide as well. Using Aoralscan Elite, you can efficiently complete the data acquisition required for full arch implant restoration cases, then send the data for design and fabrication, or perform chairside printing or milling or provisional restorations for immediate loading cases. It is an entire digital workflow with standardized protocols, ensuring seamless integration into the existing workflow and addressing previous challenges with digital integration solutions provided by Aoralscan Elite. Many steps that clinics relied on in the past, such as impressions, verification checks, and try-ins, can now be entirely eliminated. One of our main goals is to help clinics reduce the number of clinical appointments needed to complete a full arch implant restoration for their patients. With the Aoralscan Elite workflow, this is now their new reality. The clinic has been able to reduce treatment from 7 appointments to just 2 or 3, making it easier to be accepted by the patient to do the full arch fixed implantation treatment. Before scanning real patients, we need to complete a series of preparations, especially for the first-time use. These preparations include confirming the implant system and multi-unit abutments that we are using for this specific case, testing the coded scan bodies, learning how to mount the coded scan bodies, and determine the scanning strategy, among other things as well. As shown in the pictures on the right side of this slide, after implant placement, the multi-unit abutments need to be screwed into the implants. The Aoralscan Elite is designed to quickly and accurately capture implant positions, ensuring the passive fit of full arch restorations. It needs to be performed at a abutment level with multi-unit abutments. 4 high-accuracy coded scan body kit, HACS type A, B, C, and D are available to fit different implant system multi-unit abutments. Before use, please refer to the instructions to confirm and select the correct high-accuracy coded scan body kits. Selecting the wrong scan body will result in the coded scan bodies fail to properly sit on the multi-unit abutment. Here is an overview of implant systems compatible with the Elite. Find the system you are using and follow the next steps to confirm the purchase of the appropriate high-accuracy coded scan body kit. If you do not find your implant system, you can contact Shining3D for more information. Our goal is to seamlessly integrate the Aoralscan Elite workflow into your existing processes. Please make sure you follow the steps below to confirm and select the correct high-accuracy coded scan body kit for the implants and the multi-unit abutments you will be using. Each time you switch implant types or multi-unit abutments, please repeat the confirmation steps. For example, in the case below, the implant brand Noble is used as a compatible implant system. The next step is to confirm if the type of multi-unit abutments you're using is on the list on the next page. Once confirmed, it means that high-accuracy coded scan body type A kit coded scan body can be used to be mounted and fully seated on the multi-unit abutment for use. If the multi-unit abutment type is not listed in Shining3D's tested types, please contact us for further confirmation to avoid affecting the actual scanning workflow and the patient experience. This is the high-accuracy coded scan body kit A. and the compatible multi-unit abutment types. Be sure to confirm that the multi-unit abutment type you're using is on the list to ensure the correct high-accuracy coded scan body kit is selected. Please note that different implant types and multi-unit abutment types within the same implant brand may require different high-accuracy coded scan body kits for better compatibility. As shown below, the MegaGen N-type multi-unit abutment is compatible with the high-accuracy coded scan body kit Type A, while the S-type abutment is compatible with the high-accuracy coded scan body kit Type B. Double-check to ensure that the selected high-accuracy coded scan body kit is compatible with your multi-unit abutments. The second part for the preparation is to confirm the software and PC configuration or PC requirements for Aoralscan Elite specifically. As for the software part, please ensure that the software you're using is up to date. We continuously optimize the scanning process, and keeping the software updated will ensure the best scanning experience. Contact the support team for the latest version of the software. Additionally, ensure that when using Elite for scanning, you switch and select the correct device type in the setting interface. This page listed the PC requirements for Aoralscan Elite scanner to work properly. There's one thing I would like to mention is that the Elite scanner must be connected to a power delivery enabled port with a 5 volts 3 amps output. Some USB Type-C ports do not meet the 5 volts 3 amps power delivery requirements, which may cause the scanner to malfunction. Please switch to a USB Type-C port with a battery symbol. If the port does not operate properly, you can connect the scanner to an externally powered USB hub or use a USB Type-A adapter. Then we can move to the third part of the preparation. In this part, we will perform a pre-test of the coded scan body to ensure the software and the scanner are functioning properly. And we can get ourselves be familiar with how to mount the scan bodies and the scanning strategy as well. Let's first give a closer look at the high accuracy coded scan body kit. There are some important information on the box. The high accuracy coded scan body kit type is labeled at the bottom part of the box. Before you use it, confirm that the high accuracy coded scan body kit is compatible with the implant system and multi-unit abutment types for your case. You can go back to the previous chapter for a further check for the implant system of your case. The QR code and the serial number on the top left corner of the box are used to download the scan body data from the cloud. Each scan body also has the high accuracy coded scan body serial number marked on it. When returning or putting back the coded scan bodies to the high accuracy coded scan body kit box, ensure that the serial number on the scan body matches the serial number on the kit box to avoid mixing the scan bodies from other kits. For the first time use, you need to scan or type in the serial number to download the coded scan body data of the high accuracy coded scan body kit you're using. Before each scan, make sure to verify that data selected in the software matches the serial number on both the kit you're using and the scan bodies. Once you successfully imported the high accuracy coded scan body kit data into your software, then we can do a coded scan body test. You can follow the steps we listed in the screen recording on this page, and using the practice model in the high accuracy coded scan body package to complete the coded scan body test. The purpose of this test is to ensure that the following things are functioning properly before scanning. The first thing we do is to do the scan model to scan the soft tissue. Then we can check the PC and software whether it's working properly during the scan. And The next thing we need to check is the high accuracy coded scan body is recognized properly, and we can also check the correct placement of the scan body. We can use it as a practice, so make it easier when we actually doing the placement on the real patient mouth. And once we start the scanning, then you can see the scanner is capturing the data from the high accuracy coded scan body, and we can see the collection of the markers on the high accuracy coded scan body, and to find the implant position capture is good or not. It is also a test and a practice, and we can also use this kind of things to do the proper scanning strategy for all sorts of different steps, because for different steps it requires different scanning strategies, not only for the soft tissue but also for the high accuracy coded scan body, and the matching between the soft tissue and the high accuracy coded scan body. And you can also see the data alignment along the practice as well, so you will know how to do a proper scan using the new scanner. And it is also very important to know how to switch or transfer the high accuracy coded scan body data to the implant scan body that you are using for all sorts of brands. This is kind of the complete test scan using the practice model for the Aoralscan Elite for full mouth, full arch fixed implantation cases. As we just mentioned, it is also very important to capture the implant position in a correct path to ensure the optimal accuracy for the high accuracy coded scan body here. So as we just mentioned, all the high accuracy coded scan body inside the patient mouth should be closely connected with each other and pointing to the central area, which makes we can start scanning from one end of the high accuracy coded scan body to another end to make sure all the markers are accurately captured. And then, as we just mentioned, all the ends or most of the ends of the high accuracy scan body are closely connected with each other or stay closely with each other. So we can just move the scanning path from one high accuracy scan body to the closest one with this one, and still from one end to another to finish scanning for the second high accuracy coded scan body. And we can follow this path to finish all the high accuracy coded scan body scanning. Once it's done, then the whole scanning for the capturing of implant positions will be finished, and we can still maintain the optimal accuracy for this case. Those are some ideal cases we just mentioned for the high accuracy coded scan body placement, but the actual oral cavity is never ideal. So if there's insufficient intraoral space to orient the coded scan body's end towards the center, you can mount the coded scan body with the end aligned along the arch, as shown in the pictures below. When we are placing the coded scan bodies on the real patient mouth or on the practice model, before tightening the coded scan body to the multi-unit abutment, make sure there is no contact or interference between the scan bodies. If you tighten the scan body that it has interferes with the adjacent scan body, the coded scan body may not fully sit on the multi-unit abutment, leading to a final restoration that cannot achieve a passive fit. Mount the coded scan body using a screwdriver, then adjust the end of the coded scan body towards the central area. It is recommended to tighten the screw to 10 Newton centimeter using a manual torque wrench. Be careful not to over-tighten them, as this may cause a screw fracture. If you're using an electric wrench, ensure the rotation speed does not exceed 30 rotations per minute. Every time when we are mounting the coded scan bodies, it is very important to check the scan body surface for contamination from the blood or damage caused by improper cleaning or sterilization procedures. If the markers are worn, the scan body must be replaced to ensure the scanning accuracy for the following cases. Before scanning, just make sure to remove any saliva or blood from the surface of the coded scan bodies, as the markers will be difficult to capture if it's covered by the blood or saliva. It will cause reflection, make it difficult for the scanner to capture the data. The two videos on this page show the process of mounting coded scan bodies inside the patient mouth using an electronic screwdriver and a wrench. After mounting the coded scan body, ensure each scan body is secured and fully seated on the multi-unit abutment. Visually verify that the interface of the coded scan body is fully seated on the multi-unit abutments and not got stuck by the soft tissue in between the multi-unit abutment and high-accuracy coded scan body. When mounting scan bodies in lower arch, remind the patient not to press their tongue against the scan bodies to make sure it will not move the scan bodies to affect the accuracy. Help the patient keep their tongue away from the scan bodies during the scanning. It is recommended to verify the sitting of the coded scan bodies using radiographic imaging. Radiographically, you will check that the coded scan bodies are flush with the multi-unit abutment. It can make sure the overall successful rate for this kind of cases. Once all the coded scan bodies are confirmed, we can begin capturing the implant positions. Then we can move to the scan strategy part. We can scan to identify the markers on the upper surface of the coded scan bodies. These markers help in triangulating the precise position of each implant. A precise 3D model of the implant position will be generated once you captured enough marker data from the surface. Follow the scanning path and the steps below for implant position capturing. You can perform a scan that we already mentioned in the previous slides, then transitioning over each coded scan body to ensure the accuracy of the interrelated implant positions. Identify and capturing most of the markers on the upper surface of the scan bodies. Once the scan body database model appears or the virtual high-accuracy coded scan body appears in the interface, then the scan is completed. Please make sure you followed the recommended scan strategy for the marker capturing or for the high-accuracy coded scan body scanning stage. But still, if you find the results is not ideal, you can follow this page for better troubleshooting. The first results is that markers are captured, but there is no virtual high-accuracy coded scan body appear in the interface after the scanning of the markers. Then the scan results are unusable, which means you need to check if you're using the correct or corresponding scan body data for this specific case, and whether you are downloaded the correct high-accuracy coded scan body kit data for this case. And you still need to try to capture more markers to see whether the virtual high-accuracy scan body will appear in the interface. The second result is that partial markers are captured and the virtual high-accuracy coded scan body appear in the interface. The scan results are acceptable, but it's still recommended to capture more markers, including those in the hexagonal area. Check if the unrecognized marker area are damaged or not. The third result is that most markers are captured and virtual high-accuracy coded scan body appear in the interface, and which means the scan results are good. It is also very important to know how to correctly place the coded scan body for different kind of cases. For some tricky cases, as you can see from this slide, if the positions of two implants are too close to each other and the two coded scan bodies cannot be mounted in position at the same time, then you can use the group scanning function in the software. After completing the group 1 scanning, remove the interfering scan body, mount the other scan body, and proceed with group 2 scanning. As you can see from the video on this slide, once you finish the group 1 scanning with one of the two close to each other coded scan body removed, and then you can start the scanning for group 1. And once the group 1 scanning is done, you can remove the one of the two stay too close to each other coded scan body, and then install another one and start the group 2 scanning. Then you can have a complete scanning for all the high accuracy coded scan bodies. Then, how to switch the high-accuracy coded scan body data to the scan body for different brands that you're using. Before downloading and using the scan data for design, we need to transfer or switch the coded scan body data to the scan body data that you're using for different implant brands. And if it is very necessary to switch based on the brand implant library, implant and multi-unit abutment types being used for a specific case. By completing the switching correctly, and the design process can be greatly simplified in design softwares, skipping implant position detection and proceed directly to the design stage. Let's continue with the switching part. There are two different ways to perform the switching or the transferring. And incorrect switching will result in the mismatch between the products and the multi-unit abutment for the final restoration. If the switching is incorrect, it can be redone in the software and you can re-export the data for the design process. It is recommended to send the data to the designer or to the lab via the Dental Cloud platform and let the lab perform the switching on the cloud part if the clinic is not so sure about what kind of brands that they're using for the scan body. And you can still using the two screen recordings on this page for a better guide. Here is the final part of the preparation stage, the scan body sterilization. About the cleaning and the sterilization of the coded scan bodies, you should ensure the coded scan bodies have been cleaned and sterilized properly according to the following steps before each use. The first step is to rinse it for 1 minute using running water, and then the second step is to soak it for 5 minutes. Prepare a 1:100 to 1:200 dilution of the enzymic solution. Fully immerse the coded scan bodies inside the solution in a container for 5 minutes. Just make sure do not use a ultrasonic cleaner as it can damage the surface markers of the high-accuracy coded scan bodies, and it will lead to the irreversible damage to the high-accuracy coded scan body. Continue with the cleaning and the sterilization. The third step is to rinse and dry. Rinse the coded scan bodies with distilled water for 1 minute and using a lint-free cloth to dry them before sterilization. The final step is the sterilization step. We give you two different options here. One is using 121 Celsius degree at 102.9 kilopascals for 30 minutes and dry for 30 minutes. The second option here is using the temperature of 134 Celsius degree at 205.8 kilopascals for 4 minutes, and you can dry it for 30 minutes. This is the final part of today's basic training. In this part, we will give you several clinical cases and workflows related to the full arch fixed implantation. And for these two different clinical cases, one is the final restoration and one is immediate loading. We'll give you detailed information of how to create an order for that, what kind of information or things that we need to select. And we will also give you detailed information of how the whole workflow is going to be and what is something that we need to pay attention to during the whole scanning process. And without further ado, we will get into the first part of the clinical cases sharing, that is the final restoration. This is an overview for the final restoration workflow. The Aoralscan Elite scanner and software are designed to capture and align all the patient data, including bite, soft tissue, and the implant position, all sorts of data that are needed for the designing and fabricating a final full arch fixed restoration. With just one order, the entire data capture process can be completed in a single workflow in Aoralscan Elite. Before creating an order, carefully analyze and verify that all options are correct, including implant positions, whether preoperative scanning is needed or not, and whether coded scan body scanning has been selected or not. In this clinical case, after the implant surgery, the patient was mounted with a screw-retained provisional in the lower jaw after 3 months. The implant positions of the lower arch were captured using the Elite scanner. Additionally, the Elite was used to scan the soft tissue, the upper arch, and the bite. All scanning steps were customized based on the case requirements, and the software automatically generated the corresponding workflow steps. Okay, the first step for this case is creating an order. Select implant as the dentistry type to create an order. In this case, 6 implants were placed in the lower jaw. Ensure the correct implant positions are selected, especially verifying the number of implants, as selecting more or fewer implants will cause issues when scanning the coded scan bodies. In the next software version, we will introduce an option to correct number of scan bodies during the scanning process. Next, don't forget to click the HACS kit icon to designate the scan steps for coded scan bodies. Before scanning, ensure that the serial number next to the icon matches the coded scan body that you're using. Finally, add a pre-op scan step for the lower jaw to record the pre-op bite, because we're doing a final restoration for this case, and there is already a provisional for this patient. When you begin the scanning stage, all required scanning steps will appear in the workflow bar above in the scanning interface. Properly confirming the case's basic information and establishing the correct scan steps is critical for a seamless digital scanning process. Okay, the first part of the whole scanning workflow for final restoration cases is the pre-op bite. Because for this kind of cases, the patient usually has a antagonist jaw data, and we can scan the provisional for the patient as well. We can use these 2 sets of data to form a pre-op bite. And in this page, we would like to introduce 3 different scanning modes for the Elite scanning process for full arch fixed implantation cases. The first one is the intraoral mode. This is the basic intraoral scanning mode. Enable the AI scanning feature automatically removes unnecessary data when we are scanning the real patient mouth. And we also have a second mode, that is the edentulous mode. Activate this mode when scanning soft tissue to enhance the stitching of the soft tissue data for edentulous cases. And the third mode is the All-on-X mode. This is a new mode. This mode can be used when scanning provisionals. It helps to capture both the prosthesis and the transition area between the provisional and soft tissue. In this case, we first scan the opposing arch, then enable All-on-X mode to scan the provisional, and finally record the pre-op bite. This bite will be transferred into the design of the final restoration. After capturing the bite data, we then need to move to the second part of the scan workflow, that is the soft tissue scan. Enable edentulous mode to scan soft tissue. If you encounter difficulties in capturing soft tissue, you can disable the AI function from the right side of the scanning interface to gather more soft tissue data for smoother transitions. Then re-enable the AI function to continue scanning. Once the soft tissue scan is completed, the software will automatically align the pre-op bite with the soft tissue. For the lower jaw, ensure that you can capture sufficient data of the transition area between the provisional and the soft tissue. For the upper jaw, gather enough palatal data for alignment. Now that we have captured the pre-op bite and soft tissue and completed the alignment, we can proceed to the implant position capture step. Follow the guides we given in the previous slides. Mount the coded scan body on the multi-unit abutments. It is recommended to confirm the scan bodies are fully seated with radiographic imaging, especially for final restoration cases. Then, check and remove any saliva or blood from the surface of the scan bodies. Scan along the suggested path, capturing enough markers so that you can see the virtual scan body appear in the central area. Scan both sides to complete the alignment of scan bodies and soft tissue. Finally, choose to switch to the implant scan body data or skip this step to complete the data acquisition. And the whole scanning for the final restoration case using Aoralscan Elite is done. The entire Elite workflow is very simple and efficient. Unlike external photogrammetry workflows, the Elite scanner and software can gather all the data needed for the final restoration design and fabrication in a single scanning process. This is another case. Based on analysis of the case's basic information, it has been determined that the natural teeth bite can be used as the occlusal relationship for the final restoration design. And as you can see, after selecting the implant position for this case, we need to select high accuracy coded scan body function as well. And then for this case, we use the natural teeth bite for the bite record, so we don't need to select the pre-op model scan for this case, unlike the previous one we just introduced. If you know what kind of data you need to scan for a specific case, all you need to do is to select the corresponding selections in the order creating interface, and then you just need to follow the instructions on the workflow bar to capture the data step by step. In this case, the natural teeth bite can be used for the bite record, so no pre-op scan step is needed as indicated in the workflow. The step is to scan the soft tissue, to the implant position capturing, and the data alignment, and then we scan the opposing arch and we can record the bite using the opposing arch scan data and the soft tissue scan data with the natural teeth on for the bite, and then the whole scanning process is done. That's the main difference compared to the previous case we introduced. This is the third case for the final restoration. This is a full mouth implant rehabilitation case, which means for both for the upper jaw and lower jaw. It is similar analyzed based on the basic information. Note that for the pre-op model step, you need to separately add the pre-op scan step of scanning the upper and lower provisional teeth to record the bite. Additionally, set up coded scan body scanning for both the upper and the lower arches. Since a single scan kit does not have enough scan bodies to mount both arches simultaneously, at the same time, during the scanning process, capture the implant position in the upper arch first, and then remove the scan bodies and mount them onto the multi-unit abutment of the lower arch for scanning. That's the three different cases we would like to introduce for the final restoration. And then we move to the immediate loading cases. Let's look at these cases. After the surgery, we need to quickly scan to capture the patient bite, post-op soft tissues, implant positions, and complete the alignment. Then proceed to design and chairside printing. Since the patient will be waiting to try onto the provisional restoration, we need to complete the entire process with the highest efficiency. Significant changes in the post-op soft tissue may present some challenges. For immediate loading cases, transferring the patient's pre-op bite relationship to an immediate loading screw-retained provisional is a challenge. In the case above, significant post-operative soft tissue changes and the pre-op bite was recorded with a removable denture, resulting in limited data for transition areas. Scanning pre-op soft tissue data and 360-degree denture data can help with the transfer. However, accurate transfer still requires the technician's expertise. For this specific immediate loading case, we're using a potibite to record the vertical dimension for the provisional design. And we need to trim the putty and to make sure that we can not only record the vertical dimension without changing the bite data for the patient, but also we need to scan enough data from the antagonist jaw as well as the working jaw soft tissue. That's why we need to trim the putty, and then we can use the Elite to record the bite using this tool. Ensure the adequate post-surgery suturing of the soft tissue to stabilize the soft tissue around the abutments. Control and clean up blood, as it can severely impact the smoothness and quality of the scanned data. As shown in the video, the soft tissue scan can be completed smoothly within 1 minute. For immediate loading cases, it is a little bit trickier to capturing the soft tissue using the Aoralscan Elite, because normally the immediate loading cases will involve a lot of freshly sutured wounds. It may cause extra blood and saliva inside the patient mouth, which will imposing great challenges for the scanners to capture the soft tissue data. And if you encountering difficulties in transitioning data during the scan, toggle the AI function on and off to help transition from one area to another to capture the data. After scanning, access the quality of the data and delete some unusable data for the case. The next step is the implant position capturing. Follow the previous scanning steps and precautions for mounting and scanning the coded scan bodies. For immediate loading cases, pay special attention to dry and clean blood and saliva before scanning. The Elite intraoral scanner can complete the whole scanning step quickly and accurately. If we move to the soft tissue alignment step, then you will notice that we provide two different ways to do the alignment. We usually using the automatic alignment by default, but sometimes because we cannot make sure that every technician or every dentist will have the same level of perfect suturing for this kind of immediate loading cases, then if there's accessory blood or saliva to pose great challenging for the data alignment, we also provide a manual alignment for the soft tissue with the high accuracy coded scan body. So no matter the case is good or bad for the scanning, we can always align these two sets of data together. As shown in the video on the right side, manual alignment or realignment in the third-party software may be necessary. We're optimizing the software for the scanning step and adding new process to address alignment issue between the post-operative soft tissue and implant positions. Stay tuned for the future updates. Currently, this step must be completed within the software to finish the entire scanning process. Future versions will include a customizable mode to allowing for immediate data export after capturing the implant positions. This Aoralscan Elite basic training content is made based on the current version of the software. As clinical cases increase and the software continues to be optimized and updated, this training content will also be revised accordingly. Please contact your reseller or Shining3D for the latest software and the training materials. That is the end of today's basic training. Thank you all for your time and hope you had a great day. See you very soon.